Hi.
Hello to Hi9 viewers. I'm Dr. K. Srinivas, consultant Neuro-Psychiatrist. So what are the symptoms of depression? So before I tell you what are the symptoms, now I'd like to say what are the types of depression. So everyone who is going through this depressive feeling or illness has actually been going through a myriad of symptoms. It could be ranging from a simple fatigue, like you don't feel like getting up from the seat, to a major thinking abnormality, like your thinking is out of the control, like you might feel suicidal, you don't feel, you have this abnormal thinking, fear conditioning with that you might die and all that. So these all presentations of depression varies with the change in your chemical in the brain. So let me tell you, like there are like different types of depression. It happens throughout the life. So with even the life events, the depression has a different presentations. Like if you see a pregnant woman after the pregnancy, it's called postpartum depression, which comes in like 2 weeks of time. So once, if this postpartum blues, which are like most common for every after following every pregnancy, if it is not being properly addressed, they might slide into a major depression disorder. Once this steps in, it takes normally weeks and months for the mother to be too careful, because the mother become kind of highly homicidal. There have been even cases where the mother is killing the children. So this, if depression has been not handled appropriately with time, because this pregnancy creates a lot of chemical imbalance in the brain, and this neurotransmitter changes has actually causes the mother to feel a lot depressed, highly suicidal, or otherwise homicidal. So if I come to say that there are different types of depression, like from bipolar to melancholia, which is very common in these days in corporate culture, where the patient feels, or he might feel, that he's not able to perform well in the company because of his negative feedbacks, or it could be many reasons. So this functioning along with feeling of leaky bluing attitude to not even having a lot of mood swings. So these kind of mostly presentation goes in favor of melancholia depression. So if you ask me personally, these presentations, these categorical types of depression, which comes with a different myriad of symptoms, like even this chronic pain is also a major cause. And if you see a person who is being constantly irritable, is also a major sign of depression. So these signs and symptoms, from a simple mood swing to low feeling of energy, to actually having a feeling of sickness of not actually doing his regular activities, and even having a low performance in sexual life, and even having a problem with carrying their routine day-to-day work. This is also a major task, because these symptoms are too varied, and every symptom, if you see, they have been too connected in the brain. So every symptom has its, even the major memory issues these days, if you see, forgetfulness and concentration impairment, taking a proper judgment at the right time, and making a right decision in your job change to taking it to next level of your life, taking up the ladder in your career. So these also very important. In depressions, if you see, these symptoms actually has been kind of blurred. There is a lot strain. So even a simple concentration issue to decision making would also be a feature of depression. So if you are suffering from these conditions, like sadness, not just like sadness, fatigue and all that, but to higher cognitive functions like memory issues, to decision making and making a proper judgment, this all also comes under depression. So it is an hour of need to identify these symptoms and make a proper appropriate understanding of what you're going through.